Perfect. All right. Hello, everyone. I hope everyone is having a good day today. My name is Hannon, and I will be facilitating today's session with Dr. Teresa. Dr. Teresa, whenever you're ready, the floor is yours.
Hello guys, I'm Dr. Teresa. I'm a general dentist right now, currently located in Vancouver, BC, and I'm excited to share with you my journey. Just a little bit about myself. I came to Canada from Taiwan when I was 14 years old, and I did my high school, undergrad, pretty much all my schooling here and never left home. I did 2 years of science undergrad, and then I did 1 year of pharmacy at UBC. So I actually don't have an undergraduate degree. I went to dental school directly from third year of undergrad. So I entered UBC DMD in fourth year with a 94% GPA. I didn't apply to schools in the States because I didn't have an undergrad degree when I applied. And I kind of wanted to stay home because of the tuition. As you guys probably all know, that dental tuitions in the States or even in Canada is crazy expensive. So I wanted to become a dentist since grade 10. And I started shadowing a dentist every week since grade 10 up until before I applied to dental school. So I was very committed for many years. And that definitely helped me know that dentistry was something that I wanted to pursue. But I also had a very good mentor that could motivate me and inspire me as well. So a lot of people ask me why I want to become a dentist. Well, there are many reasons, but in short, I like working with my hands. I have always enjoyed arts and crafts, and I wanted a stable job. I thought that as a dentist, you graduate and then you will get a stable job and you don't ever have to worry about competing with other people because you have a unique skill sets, which is not really the case right now. I probably will talk more about it about the job market if you guys are interested later. So, and I wanted a work-life balance. My dentist always seemed really relaxed and having a lot of time for vacation, for tennis after work. So that was the type of work-life balance that I wanted to pursue. And the most important thing was I have always wanted to become a doctor, some forms of doctor, because I adore the patient relationships. I wanted to be in a field where I can see kids grow up and see their children, their grandkids, and so forth. So that's why I wanted to become a dentist. And these pictures, as you can see on the top left corner where everybody was wearing a lab coat, that was the white coat ceremony. That was a special day for all of us because it again reminded us that it's been a tough journey getting to dental school and why we're here. The middle picture, that was when I finished, I think, third year of dental school, and I went to a First Nation reserve to work as a student dentist during summer program. And that was the salmon that I caught. It was really big. So I ended up having salmon dinner for 3 months straight. That was a really great experience, and that expedited my clinical skills and my confidence, allowing me to transition to my fourth year of dental school much more smoothly. On the right-hand side, where you see everybody in the Japanese outfit, that was an exchange program that I went to. We were in Tokyo and Niigata for 2 weeks, and we were hosting Japanese dental students during the winter as well. That was probably the highlight of my dental school. We were able to build a lot of meaningful relationships, and I have to say, I thought Canada, I didn't know Canada is that backward. Like in Japan during school, the mannequin head they had were all robots. The mannequin head that they could do dental work practice on, the mannequin head could speak, could spit, could choke on saliva. It was really cool to see the advanced dentistry in Asia. And on the bottom left, that's just a group of us taking pictures after a normal day where we were all in scrubs waiting for our patients. Sometimes we had some events as well. So dental school was very tough mentally and physically It was also very rewarding, though. There were a lot of beer garden events and a lot of cool parties that the dental companies will provide. And hopefully you guys get to experience that in the future when states and Canada are slowly open up from the whole pandemic situation. So last but not least, the bottom right picture is me and my husband. He was just a classmate of mine, and his ob was always next to mine. So throughout dental school, you will either become best friend, or you become married, or you become enemies. So him and I became married. We didn't get together until fourth year of dental school, but yeah, throughout dental school, he was always next to me, and I was the messy one. He was the neat one. So I would always go to his op to steal his tools, and he steal his mannequin teeth. So in UBC, we're pretty fortunate that every student gets their own cubicle instead of having to be very crowded and work on the mannequin head right next to each other. So every of us has a little operatory all to ourselves. Okay, and let me see. Okay. So after I graduated from dental school, I actually went to rural community to practice for a year and a half. Rural, I meant there were still 10,000 people. There was still a Costco in that community. So it's not that small. I don't think I could ever go smaller than that. I need at least Costco in my life. So we went there. That was about 2 hours flight from where I'm living right now. So it was my first time leaving BC, leaving Vancouver. And of course, I went there with my boyfriend at that time. We didn't work in the same practice. We were working in the same town in different practices. I wanted to go rural because, like everybody, we had a lot of debt. We graduated with $250,000 of debt each person. I think in the States, it might be even worse. So we wanted to pay out our student debt a little bit faster. And I heard that you get to earn more in a rural community. Was it true? Yes, it was true. We were both able to at least find full-time position. And most importantly was not the money. Most importantly was because there weren't a lot of dentists in my community, so I got to do everything. So I got very comfortable with molar root canals and surgical extractions, which a lot of young dentists often struggle in, because this area, you get limited exposure in school. And when you attempt difficult surgery cases, you really need a mentor kind of holding your hands and backing you up when you're stuck. So I'm very thankful for that experience. And that experience, whatever I learned under my belt, was able to get me a very good full-time position when I returned to the city. So now I'm a full-time general dentist working in downtown Vancouver. And to be honest, I'm actually busier than I was in small town. So is it true that you get to make more in a rural community? I don't think so, but it's a little bit easier to find a full-time position in a small community. And as a new grad, for sure, if you were to stay in the city, your growth will be a lot slower. So I wouldn't be able to be in this position without my experience in rural. At least I don't think so. So I'm now the main dentist in the downtown clinic. And I am doing a lot more of, so a picture on the right side is my assistant. It's really rare to find an assistant shorter than me. So I am very treasuring her right now. We make a good team. And yeah, so the next step is my husband and I are building our own clinic. It's also going to be in Vancouver downtown. Yes, so next one. So I do all aspects of general dentistry. In Red Deer, which is the rural community that I was in after I graduated, I was kind of the pedodontist in my office. Like all the dentists in the office didn't like to see kids. So I see a lot of kids then, and I invested a lot of educations on children development, phase 1 ortho, phase 1 meaning like the appliance to open your jaw, to advance your jaw. as phase 1 ortho, and I got to do a lot of these molar root canals and extraction cases. I don't do so much of a surgery or extractions right now anymore. I still do all the other aspects of dentistry, and I'm really trying to hone into cosmetic dentistry. That's where I am right now. So I'm taking a lot of CEs on Invisalign and digital smile design. And yeah, little pictures on the right side, you can see that that is an example of what you can achieve with phase 1 appliance. So this girl is 7 years old with a little bit of crowding in the bottom jaw. After that appliance, after a couple months, 4 months, you can see that appliance was able to push those 2 starred teeth forward. And she probably doesn't need to have braces when she is older. Okay, so this is just a little bit about what I do now. I do a little bit of a smile design, like composite veneers or porcelain veneers, and I also do Botox. And you can see before and after the wrinkles are much more smooth for Botox. You might be wondering how come dentists get to do Botox? It's nothing related to what we do. In fact, that is wrong because a lot of patients suffer from grinding and clenching, and not everybody can tolerate night guard. So if you can give Botox at the clenching muscles to relax it, you can actually help to relieve the damage from grinding and clenching. At the same time, if a patient has gummy smile, like when they smile, they show a lot of gum on the top, there is only so much gingivectomy, means gum removal, you can do. So in that case, you can put some Botox near the nose to relax the uplifting muscles from your lip, and the lip will drop a tiny bit, and that correct gummy smile. So I believe that Botox is definitely needed in the overall treatment planning. I'm still waiting for the day when dentists in Vancouver are allowed to do fillers. I know in the States or even in Alberta, dentists can actually do fillers like lip injection or nose injection. And I don't know why we can't. I mean, when we do smile design, we're really changing the whole aesthetics of the face. When we're doing ortho, you're changing the bone structure of your lower jaw and your side profile. So I really hope that one day we get to do the filler to complement everything that we do for the patients. Okay, so some people ask me, what courses do I need to take to get to where I am right now? Well, I guess most of the audience of this presentations, you guys are probably still in undergraduate degree, or maybe some of you guys are in high school. So the first step you need to do is to get into dental school. And every school has different prerequisites, but basically you need English, chemistry, biochemistry, or some sort of science courses. And then you need to take a DAT. It's an entrance standardized exam and then you need to pass the interview to get into dental school. In dental school, every school teaches you a little bit different stuff. Of course, as they will teach you the basic, fillings, extraction, crowns, and bridges, but they're not going to teach you like implant, ortho, or cosmetic dentistry. That's more on you to learn after you graduate. So not every dentist does this type of stuff, and it's totally fine if you don't want to. Like as a general dentist, the majority of the income, surprisingly, is actually just from the filling itself. These cases are not the most profitable. They're just kind of fun to do, unless if you become an expert in the industry and then you do this all the time. Yeah. Okay, let's talk about a few interesting cases to show you like things that we need to do as a dentist like on a daily basis. This is called Abfraction, and I bet if you guys are probably too young to see these lesions in your mouth, but if you look into your parents' mouth or your auntie's or uncle's mouth, I bet at least one of them has a lesion like this. So this is called abfraction. A lot of dentists or a lot of people will think that is recession. It's the one of the biggest misconception out there. It's not recession. You can see the gum is still very healthy. What it is, what happens here is the enamel along the gum line has been chipped away. And why did that happen? When you bite down, your teeth will flex. Okay. And over time, if it flexes too much at the neck area, enamel is really thin and it chips away over time. So it can be, it is a multi-factor problem. It's a lot of time grinding and clenching puts you at risk for lesion like this. Sometimes brushing too hard will also become like that. So when you have enamel chipping away, sensitivity happens and the dentin being exposed, the dentin is much softer than enamel, which is a lot more prone to cavities. So on the picture on the left side, you can see that is a little bit brown there. That's all cavities. Picture on the right side, that's the pictures taken after the cavities are removed. You can see a little bit of pink in the center where it's that little dot there. That's actually where your nerve is. So that's the entrance to the nerve. So what happens? This for sure that, sorry, let me see. Okay, yeah. You'll be surprised. Some of the patients with lesions like this, they actually are asymptomatic. It doesn't really hurt too much because with teeth, after they're traumatized, you actually lay down a tertiary dentin, which is the reparative dentin that is a lot less sensitive. But some people, it's just, no, this will really hurt them, becomes very, very sensitive, especially when we get really close to the nerve. So what is the treatment for this? Well, you have tooth loss problem. So you will need to do a filling. That's basically what we do all day, every day, a filling. But the fillings like this is really tricky because it's really low below the gum. And when we need to extend the filling below the gum, you have to worry about bleeding. Bleeding and saliva are the worst enemies of these white fillings. So you will need to control the moisture really well. You also need to warn the patient the possibility of needing a root canal, and that comes down to patient communication. As a dentist, the hardest part of our job is on top of staff management, that's really hard. Also is patient communication. You need to make sure that you set the expectation correctly. So let's say if today you clean out the cavity, you put in the filling and the tooth didn't hurt before. Maybe after filling and the freezing wears off, the tooth starts to hurt. It's not your fault. It's just because it's really close to a nerve. And if you didn't warn the patient can come back and say, hey, you mess it up. You caused my tooth to hurt. You got to pay for my root canal. You just don't want to get yourself in that situation. So I always take pictures, always warn the patient what can happen, always prep them for the worst so you can always deliver better. And that's so important. Yeah. So a lesion like this, you can imagine this girl was actually a 21 years old girl. She really cares about her appearance. So she never smiled really big because she actually had a lot of lesion like that in her mouth. And after I patched it all up, you can see that after the fillings is in, we polished really well, the color matched really well. And the texture looks like she's never had work done there. So she's now a lot more motivated to smile more and brush more and take care of her teeth. So you're not only just treating teeth, you are really helping the overall confidence and the patient's well-being as a dentist. Okay. This is another type of case that I've been doing and will plan to do more, and something that I really enjoy is smile design. So this guy actually did a smile design for his husband already. So he came back to me, and his husband's case was much easier than his. And he said, "Oh, you did a smile design for my husband. Can you do one for me?" I said, yes, of course I can, but look at how, so left side is the before pictures, right side is the after pictures. Look at the before picture. Look at that, his two front teeth are tilted kind of inward and are ground down a lot. There is a black triangle in between his two front teeth. there's a huge gap between the second tooth and the third tooth, a huge gap on the other side. It's a really tough case to have to do composite veneers. But unfortunately, he can't afford porcelain veneers. What is the difference? Composite veneers essentially is challenging the dentist's hand skills as an artist. This is pretty much, you can imagine, you have to build everything from scratch. It's like sculpture. You need to sculpt it into where you think you want it to be. Whereas porcelain veneers or crowns are different. You prepare the teeth, you take an impression, you send to a lab. The lab technicians will make the crown for you, and you just glue it on. It has no aesthetics or artist skills. It's more of a clinician type of skills. But composite veneers really test your artistry. So that's basically what I had to do for him, and it turned out really well. He is very, very happy. The shade blended in beautifully, and all the gaps are closed. I'm very proud of the results. However, composite veneers, the downside is that composite, as I said, you're building it layers by layers. So it breaks more easily. It also stains more easily. It doesn't last as long as porcelain veneers, but the price is also half or even 1/3 of the price. So that's give and take, right? And you just have to manage the patient expectation. Get them a night guard, let them know that in the future, likely is you will need to get a redone or get a porcelain veneers. But composite, so this work, composite veneers, I did not remove any tooth structure at all. It's purely adding on to the existing tooth structure. So it's very conservative, and you get to see the immediate results. And that's also something that I really enjoy as a dentist, is that sometimes as a family or sometimes as a physician or a family doctor, you see the patient with chronic pain, you see the patient with diabetes, and you don't see them again, or you see them again after 3 months, the condition is still the same. You don't really know what type of value you bring to the patient. But as a dentist, it's no, you freeze the patient, there's a before and after picture. You know that you have provided value to the patients already right away at that time. And that is able to, that gives me a lot of joy. I love helping people, and it makes me feel like my time is worth it, that I get to see the results right away. Okay. So I guess that leads me to the second point is a lot of students will ask me, oh, they don't know if they should go to dentistry or medicine. I was in the same boat. I considered the same type of questions. I actually took MCAT. I considered applying to medicine. But in the end, I still chose dentistry for a couple of reasons. And I wouldn't, of course, I'm biased. I'm a dentist now. Of course, I would say dentistry is better. Dentistry is the best. But I guess I will just give you kind of my 2 cents of my thought process of what helped me to decide. And maybe it will provoke some thoughts for you as well. So dentistry and medicine, some of the difference or why I chose dentistry over medicine is that dentistry only has 4 years of school. I don't have to do residency afterwards. And of course, if you want to specialize, you need to, but it's not a requirement. There's no on-calls. So important. My husband said in my previous life, I must be a pig, that I just eat and sleep all the time. I need a lot of sleep, like at least probably 8 to 10 hours, preferably every day. So I know myself, I cannot survive for on-call shift. And as a general dentist, you get to perform all procedures. And I love that. I did consider about going back to school for pedo to become a pediatric dentist. But I decided to stay as a general dentist because I know I kind of get bored in one procedure pretty easily, and I want to always learn. So as a general dentist, I can do everything and I never get bored. I also have the right to refer. If I don't like this patient, I can simply just tell him, oh, it's too difficult for me. You got to see a specialist. In fact, it's just because their personality is too hard to handle. So I still want to have that right to refer. That's why I don't want to specialize in dentistry. And there is also not a single area where I feel like I have like a huge passion in. I kind of just like everything. So, and the fourth point is that, as I mentioned, you get to see immediate results, immediate gratification. You know that you have done something for somebody. And it's a combination of aesthetics, craftsmanship, surgery, and healthcare. As a medical doctor, you probably will need to become a surgeon to be able to do these kind of craftsmanship or surgery. But as a dentist, you can do all of that as a general dentist. You get to be your own boss. Sorry. This is something I thought. Yes, you still get to be your own boss. Like my husband and I are starting a clinic and we will be the boss of the clinic. But that doesn't really mean anything. Being a boss just means you have a lot more responsibility. I think the best boss in the world is the one that doesn't talk like a boss. Get your hands dirty with your staff. You walk the talk, you don't talk the walk. You have to like be a good team player. So if you think that you can be your own boss, be mean to other people or like talk down, that's like not the case for dentistry anymore. I know some of the older dentists, they treat their dental assistants like crap, but that's not how the young dentists work. And in fact, dental assistants are in such a shortage right now. It's really hard to find them. So if you find a good one, they become your boss. They get to boss you around. Now, my little assistant, she gets to boss me around. Some of the challenges of becoming a dentist is that there is a negative public perception of dentists. That it's very expensive, we're money hungry, the things you do for the patients are painful. Most patients have dental anxiety, they don't like their dentist. I actually see this as an advantage, and it should work in your favor, because if you become that one good dentist, you will have so many loyal patients. If you get to have that one dentist who has a nice, comfortable, modern, good, relaxing clinic, you get to stand out. If you get to become that dentist who can provide painless injection, you never will have a problem of not being able to get any patient. So I would say don't worry about that. Of course, there's a lot of challenges. A lot of patients, first thing they open their mouth and say is, I don't like coming here, or I don't like dentists. That's what they always say. But I don't take it personally. In fact, I actually kind of think that as a challenge, and like, I'm going to change how you think about us. I'm going to change how you view dentistry. So it doesn't bother me. It's actually a drive for me. Second, of course, very expensive tuition. And that's very unfortunate, tuition being so expensive, material being so expensive, staff, overhead. In the end, who end up paying for it is patient, and it's just a bad cycle. But I don't think we can ever change that, just because our healthcare system, dentistry is a private sector. Whereas in Asia, the basic dental procedures are covered by healthcare, like MSP. But that's just not the case in North America. So expensive tuition. Can you ever pay it off? Yes, you can. Dentistry tuition, dental students' tuition is not there to bankrupt you. In the first couple of years, you probably can only drive a secondhand Honda, cannot eat out every day, and save up to pay off your tuition. But that's okay. It probably just takes a couple of years. And then later on, you get to live comfortably. I don't think as a dentist, you need to worry about money. You're not going to become ultra rich and driving a Ferrari around or living in a mansion. No, that's not going to happen. But you can live comfortably. So that shouldn't be a concern. But I also know how nerve-wracking it is, because I remember how much stress I was in every day looking at my bank account after I graduated. But every dentist will tell you, in hindsight, you will always end up paying it off. This is something that's going to be quite difficult. So job market is actually not as secure as you think. Just like in every profession, there's always going to be the good players and also going to be the one not doing as well. Same as dentistry. If you're not good, either not good at treatment planning, not good with patients, or not good with your hand skills, you can be fired. Like the previous associate in my work, he was fired by my boss because he didn't have a good hand skill. So you can face that problem as a dentist as well. And as in the city, it is very saturated. We have way more dentists than needed because they keep on accepting international dentists. The domestic dentists, like who graduated from domestic schools, they're actually very, I think it's like less than 10% of the whole new dentist every year. But don't quote me on the number. It's really low. But yeah, the job market is not as secure, and you will have quite a bit of competition. And then the last one is probably something that can make some people choose medicine over dentistry, and I agree with such decision, is you're gonna have neck and back issue. Every dentist suffer from that. And so our lifespan is not as long as a family physician. So if my kid wants to become a family doctor because of this reason, I say, yeah, go ahead. Because neck and back issue, it's something that it's quite tough. I hope that there will be some good questions at the end. It's kind of weird talking by myself. But okay, last but not least, you guys are probably still thinking about your career options. I would say shadow as many different professions as you can, and really be realistic about yourself, about your strength. What do you look for? And don't have that, at least in Asian family, they either want you to become a doctor, engineer, or accountant. Is that? Yeah, I think so. Or lawyer, because these type of professions tend to have that high public perception or being praised by the public. I think it's false. You really need to be realistic with your strength, your weakness, and what you look for. So shadow as many professions as you can, and it doesn't matter what you end up choosing. Dream big, set your eyes on the prize. You will definitely struggle. It's not an easy route. Even after you graduate from dental school, it's still not easy, but you don't give up. You will get there eventually. And cliche has it, like, life is not about destination, it's about a journey, which I feel wholeheartedly, because I was go. When I got to Canada, I tried really hard to get out of ESL so I could get into honor program, so I could have the highest GPA to enter university. After I got into university, I was rushing to get into dental school with the highest GPA with the shortest amount of time. I'm always like hustling, and like thinking back, I wish, hard to say. I mean, I don't regret, because I get to be where I am in the shortest amount of time. But honestly, I don't feel like I had the healthiest mental state. I was so stressed that I was losing hair. My period didn't come for half a year, because I was so harsh on myself. Now I am really taking a step back, and finding a balance is really important. So I just really want to encourage you all. Like, I don't know where you're at in your life, and in your academic pursuit, but if you're struggling, don't give up. But at the same time, don't beat yourself over failures. What I've learned is that when you are encountering some failures, stop reflecting back to you. Like, you didn't do well on this test does not mean you're stupid. It just means you didn't get that questions. It's okay. Just learn that questions and move on and take the next test. Like, stop connecting failures to back to who you are, so you don't have doubt about what you can achieve. And if one thing I can tell you guys is to aim for excellence and not perfection. And please remember that, because it doesn't matter what profession you end up getting into. I think if you will spend time watching this shadowing an online webinar, it probably means you're type A personality, you're pretty gung ho and you want to aim high, you want to do more, but you probably are pretty hard on yourself too. So please remember, don't aim for perfection, aim for excellence, and you will go very far with that. Okay, so I think I have said enough. Okay. Oh yeah, this is my social handle. If you have more questions, you can message me on Instagram, or if you're watching this, please tag me in the story. I'll be really happy to know who I have helped and who I spoke to, other than my MacBook today. I'm a little bit more active on Instagram for English speakers, because my YouTube, I changed my content from English to Chinese, even though I have English subtitles. But I think, yeah, it's more tailored to Chinese patients, promoting oral health now for my YouTube channel. But sometimes I will still post 1 or 2 videos about my dental journey. So yeah, so you can follow me on both social media and fire me all the questions.
Awesome. Thank you so much, Dr. Teresa. This was a really amazing session. So thank you very much. Now for some of the questions that have been coming in, the first one is, what dental experiences did you have before you started dental school, and how did they help you during dental school?
So like I said, I was shadowing my own dentist since grade 10. So every week I will go shadow him. I would observe what the assistant does and what he does. And I was the starey girl. I essentially just cleaned the instruments for him. And I finished all the snacks in their staff room. that's it. I didn't really learn any of the technical aspects of dentistry, and I don't think you need any. Some of my classmates, they were dental hygienist or dental assistant coming to dental school. I don't think, maybe they had a little bit easier start because they didn't need to learn about the terminology or some of the basics, but it's fine. You don't need that. You don't really need any of the knowledge going into dental school. I think shadowing experience helped me to learn how to be an inspiring dentist, because my mentor was one. I will always remember one incident where he was, after he finished a filling, he was like, I'm a Christian and he was a Christian, and he was talking to the patients about like God, about like just helping them with their own personal struggles. And I found that so amazing. And I think I observe a lot of the interpersonal skills and how the good dentist should be. And I think that's all you need going into dental school. And you need to be able to find your passion so you can get through the difficult time in dental school, and knowing that it will be all worth it in the end.
Awesome. The second question is, did you have a hard time adjusting to the rigorous curriculum of dental school? And if so, did you change your study habits or anything like that?
Which curriculum?
Like the dental school curriculum. So was it difficult, like adjusting to the rigor or the amount of content that you guys learned?
Not really. I think I had a pretty good study habit before dental school. But dental school was more, I would say, like having a group of friends, it's very important in dental school. You cannot go through dental school alone. And I did I kind of went through high school and undergrad alone. I and I tried to do that in the first year. It didn't really work. So in the end, I had a group of very, very close friends. We would divide and conquer. Like I would do the notes for this section really well and teach everybody. And then he would do the note. Like we kind of work together, and then we come up with test questions and we help each other, because the content, there's just so much content. And sometimes like dental school, let me give you a typical example of what a typical day of UBC was like for me. Was I have to be at school at 8 o'clock. So my commute was 40 minutes. I have to wake up at 6, eat breakfast, and get to school at 8. And we have a morning session that you cannot be late for, 8 o'clock. And then all the way you have to do lectures all the way until 5 o'clock. And then 5 o'clock, you had dinner for 1 hour. You go back at 6 o'clock to do evening practice until 9 p.m. And then after 9 p.m., you finish school, and then you're studying until like 12 or 1. And then the next day repeats. It's really tough. So some days I had to skip to rest, and I had to rely on friends, like taking notes and writing questions. And also dental school, I think the most importantly is that I guess the biggest difference is that before I got into dental school, I kind of was striving for perfection, as I said. So before, when I prepared for a test, I literally was trying to have photographic memory. I know exactly the content is on which page, on which corner. I need to remember every details, everything possible, because there was not that much content. And that's how I prepared for the exams, that I was aiming for 100% all the time. But dental school, you simply just can't do that. You're just trying to aim for a pass. and, and like a person who graduated dental school with a 99% average might not be as good of a dentist as the person who will graduate with a 61% average. Of course, you always try to aim better, but don't be too hard, because in dentistry, it is impossible to know every single content. So that changed kind of my study habit. If I feel like I am done with this section, I'll move on. I know I can pass this section, then I move on. Yeah, and then just look at past exam questions, then to try to memorize everything. Yeah.
Awesome. And then in terms of studying for the DAT, what resources did you find to be the most helpful throughout the process?
Because I took, that was a while ago, I took MCAT as well. So I think MCAT prepped me really well for the science and math and English. DAT, like I think the science and math and English portion on DAT is easier than from MCAT. So then I feel like if you use the MCAT book to study for the science portion, it might be a good idea as well. Just so you're a little bit over prepared and you can find that the exam's not too difficult. And then the PAT portion, I would say just practice after practice, because it's about speed. You need to finish many questions in a short amount of time for the PAT session. Yeah, but DAT, the ink, I remember compared to MCAT, it was not as difficult. So I just used I forgot the name, but like I think Kaplan or something with B, like the book that you can buy on Amazon. Those were sufficient.
Awesome. And the other question is, if you could change anything about the field of dentistry, what would it be?
You guys asked such a good question. I feel like I'm doing like a world pageant. You know what? I actually won't change anything, because by the time you guys graduate, still probably is around the same era. Dentistry is changing, but it's so good that you're part of the change, because you get to outcompete the older dentist. For example, a lot of some of the offices that I have worked at, or even the one I'm working at right now, they're just like, run by older dentists, and it's still not digital. They're still, lacking a lot of patient communication. And that's where I think the young dentists can really make a difference. So I wouldn't change a bit, because that's what makes us unique, and that was that give you advantage. Tell you an example. The hardest thing in dentistry is not to diagnose and treat. The hardest thing in dentistry is to monitor the change. For example, like you go to see a dentist, the dentist tell you that, oh, you're grinding your teeth because I see some wear on your teeth. But the dentist will never be able to help tell you how much you're grinding, if you're still grinding, how your teeth has changed since the last time he saw you. He might take a couple pictures, but you can never monitor the change just by picture. So that's something that is lacking, and that's something that I'm really trying to implement in my own practice. I'm having an iTero scan. I will scan every single patient when they're a new patient, so they have a baseline. And I'll scan them again in a year. And I can really show them with the digital simulation to show them, hey, like, you're grinding. Look how these teeth is reducing at 2 millimeter every month. Like, I can give like data, I can give simulations and animation to help with patient's communication. And I think that's so valuable in dentistry, and that's definitely where it's going. At least that's where I want to take my practice to. So yeah, I won't change a bit, but these are something that what dentistry is changing towards to. Everything is getting digital, is getting more like the patient communication is different. Like before, you go to the dentist and just say, you have 8 cavities, and you just go and make an appointment. It's not the case now. Patients are a lot more educated. They have a lot more dentists they can shop around. You have to sit down and educate them and show them. And yeah.
Okay, and then the next question is, if you were not practicing dentistry, what would it be?
I wanted to be like a professional, I forgot what it's called. The person that you like go around and eat food and sample food. I wanted to become like that. But I realized that food critique. But I realized to become that, you actually have to eat very bland food every single day. So I didn't want that. But other than that, I would consider probably like medicine. Like, I still want to be in healthcare. I still like being a doctor, being able to educate and help and change lives.
I totally agree with you on the food critique occupation. I would totally consider that as well.
I actually consider that. I actually Googled it. I was very serious about it. But I realized, no, you actually have to eat very bland every day, and that's no fun.
Yikes. Okay, and then for our closing question, it will be just 1 second. So as you said that during your undergraduate journey, I guess it was kind of doable to, memorize everything and be able to, strive for like A's in the different like upper level biology classes and whatnot. But in dental school, you said it was difficult to do that. So what were your grades like in dental school, and do grades really matter, considering that, at the end of the day, everyone is just going to be a dentist when they graduate?
No, the grades don't really matter in dentistry unless if you plan to specialize. But even if you plan to specialize, unless you want to specialize right away after dental school, then they look at your dental school GPA. But if you plan to practice for a couple of years and apply to grad school, your work experience and your research experience by far outweighs your academic performance. My dental grades, I cannot remember like a letter, because there's no letter after every year. I think just every block. Maybe it's in like A minus or B. I can't really remember them that much. See, it doesn't matter at all. But for dental school, I have to say though, I had like a little bit of burnout because I didn't have a break going to dental school, and I was studying nonstop before, and I was in my personal lows during dental school. Like I had some family issue that I had to deal with, so I had a hard time focusing throughout dental school. But that's where having a group of friends will really carry you through during difficult times. But,
Perfect. These were amazing questions and amazing answers. Thank you so much, Dr. Teresa, for joining us during today's virtual shadowing session. The presentation was amazing, and we are so happy that we were able to get to know you more. Thank you.